Hello, and welcome to the My Heart and Mind podcast, where it's all about creating the feel-good mindset so you can make the most of every moment and reap the benefits of getting the most happiness out of life. And now, over to your host, Sally Crawley.
My show is for you if you've had a heart attack, heart surgery, a cardiac arrest, or your life has been impacted by a cardiac diagnosis. It's all about mastering your thoughts and feelings and emotions so you can feel great and live a life that you love despite your diagnosis. Thank you so much for joining me today. Just before we get into the show though, please be aware that my work is not intended to replace conventional medicine. It is complementary. If you have any concerns about your health or your heart, then do seek medical expert advice immediately. Good morning, good afternoon, good evening, good night. Whatever time of the day it is, welcome back to the show. Today I'm asking a vital question. Can a heart attack, cardiac arrest or open heart surgery cause trauma or even PTSD? The quick answer is a resounding yes. Many of us, after a life-altering cardiac event or chronic health condition, find ourselves grappling with more than just physical recovery. It's completely normal to feel overwhelmed, like your own body has become an unsafe place. In this episode, I'll delve into what PTSD looks like after a heart event, from hyperarousal to avoiding vital appointments.
Can a heart attack, cardiac arrest,
why your
or
brain
open
creates
heart
these
surgery
protective
cause
triggers,
trauma
and
and
most importantly,
PTSD?
what you can do
The
about
quick answer
it.
is
Recognising
yes, of course
these
it can.
feelings is the first step.
Many
And
people, just
speaking
like
with
you
your
and
doctor
I,
is key.
experience
You're
trauma
not
when they're
alone, and
diagnosed
help
with a
is
chronic
available.
health condition like heart disease, or have gone through a traumatic event like a heart attack, cardiac arrest, or open heart surgery. It's not only cardiac issues that can cause trauma, but other chronic long-term diagnoses too, such as cancer, MS, Parkinson's, etc. Your event or diagnosis may be something that you're currently going through, or it might be something that happened a while ago in the past. So if you are feeling that you have any trauma or PTSD, it's well worth listening. Firstly, it's completely normal to feel this way. You've been through a life-changing event in your life and are trying to make sense of it. Wondering how to manage your mental health as well as your physical health and keep your risk factors down, and it can all be really quite daunting at first. When it comes to something that has happened within us, it can make living in your own body feel like an unsafe place to be. So what's my best advice? It's knowledge. Learning what has caused your trauma, what trauma is, and how you can go about treating and managing it. Hopefully this is where I can help and start you off today. Post-traumatic stress disorder, PTSD, in a nutshell, is anxiety that's been brought on by a traumatic event. This anxiety can form in different ways in different people, from reliving parts of the event, fear of going to sleep, an extreme increase in rage, guilt and irritability, avoidance of these triggers that cause you to remember the events, very realistic nightmares, and intrusive negative feelings and thoughts that affect you every day of your life. If you've avoided a hospital appointment following a diagnosis, not wanted or been able to sleep at night, or decided not to make lifestyle changes as you're worried this will make it all seem real, these can be triggers which can cause your anxiety and the feelings of panic to rise to very high levels. Hyperarousal can be where you believe every feeling of discomfort inside you could be something far worse than it is. It took me months to realise that I was focusing on every heartbeat, every breath I took, every twinge or pain in my chest. I was terrified I was having another heart attack. I wouldn't even leave the house for months. All of these kind of things are symptoms of PTSD. Does any of this sound familiar? Well, a heart attack or major heart surgery is more than enough to bring on all of the above. You certainly are not alone with these feelings. Research suggests that 1 in 8 people suffer from PTSD or trauma following a heart attack. It could be as many as 1 in 4. But why does it happen? Well, when you experience something traumatic, your brain's ancient alarm system, in the reptilian brain, instantly activates the fight or flight response. Even after the danger is over, your amygdala, the brain's emotional memory centre, stores that terrifying experience. Later, if something reminds your brain of that event, a trigger, your amygdala can mistakenly send that danger signal. It could be when you notice a twinge or a change in your chest, or breathing, or when you go to collect your medication even. This trigger causes your body to react as if the trauma is happening now, happening again. It's creating the physical and emotional symptoms of a trauma response, even when you're safe. I'll talk more about what happens in the brain to create PTSD and trauma in another episode. Learning what your triggers are and realising what your coping mechanisms have been is key to the treatment of your traumatic response. If not treated, trauma can sometimes get in the way of your cardiac recovery, holding you back from feeling confident and able to cope emotionally. It can increase your risk factors too, as we all know that stress can cause higher inflammation levels in your body. It can also increase blood pressure. When it comes to your heart, this is the last thing that you want. The first step, of course, is recognising your symptoms. Realising that you are experiencing some or all of the symptoms of PTSD. Being honest with yourself that you are worried and struggling is a big step, but the most important one. The second step would be to speak to your primary doctor. Whether you do this face-to-face or by phone, it's vitally important that you speak with your doctor. They'll be able to initiate the correct form of treatment and or medication for you. It's important to remember that it doesn't matter if you've lived with the effects of trauma for a while or if it's a recent occurrence. It's never too late to start treatment and to get help for yourself. You may not have even realised how much it has affected the quality of your life. When you see your doctor, he may start with something called watchful waiting. This is to assess and monitor your symptoms to see if they do decrease without any medications and what can be triggering the feelings. For the most part, people do tend to see a decrease in symptoms just from doing this exercise, but not everyone will. If symptoms don't improve, then the doctor may decide to refer you to a talking therapist. Often it will be cognitive behavioural therapy, CBT. It teaches us how to recognise the triggers from trauma and how our brain has used these triggers as a protective mechanism. With time, the therapist will work with you to reverse these coping mechanisms by learning the link between your beliefs, the feelings, and behaviour. They'll teach you how to control your feelings and how to build coping strategies so you feel a lot safer. This can be implemented in numerous ways, including self-talk. If you've been experiencing nightmares or even flashbacks, these can be treated by talking about the events that have happened and recognising them and how you felt at the time. There are, of course, other options that can work really well. They are counselling, EMDR, and blast therapy, but I'll talk more about them in another episode. You need to be able to treat your body after the heart event or diagnosis and be able to go to the treatments whilst controlling your feelings of anxiety. It's key to coping and getting better. There are things that you can do to help yourself also, from exercising to talking to friends and family or support groups and just generally taking good care of yourself. You may or may not be offered medicine to help treat the trauma. Antidepressants are commonly used in the treatment process, but make sure you talk this through with your medical team and you do what's best for you. Above all, though, remember that trauma and PTSD is real. It is treatable and common in people who have had a heart attack, cardiac arrest, or have had heart surgery. You are never alone. So thank you for spending time with me today. You can find all the links in the show notes and read this as an article on my website. You can just pop over to www.myheartandmind.co.uk/podcast. If you enjoyed today's show, do make sure you follow us so you don't miss out on any episodes. And before I go for today, I just want to remind you that you are loved more than you will ever know. You are admired by more people than you'd ever expect. You are worthy of joy and happiness. See you later. Speak soon.